Welcome back to Health Matters. I'm Dr. Mark Castellaw. You know, surgery on children, no matter how minor, is a nerve-wracking thing for both the kids and parents. Joining me today is Dr. Fawn Lewis for her second appearance on Health Matters. She also is a new addition to Baptist Medical Group and a pediatric general surgeon. Welcome, Dr. Lewis.
Thank you very much.
Got a beautiful first name, Fawn.
Thank you.
Wonderful. It's my wife's middle name. Anyway, now, what are some of the most common types of pediatric surgeries?
The most common thing we do is usually hernias, actually, on toddlers. Other common things are appendectomies for appendicitis and drainage of abscesses that can occur anywhere.
Now, with adults, we're very familiar with minimally invasive surgery where they do the laparoscopes and get the little Band-Aids. Is that something that happens with children as well?
Absolutely. It's one of the biggest advances recently that we've been able to perform the same operations but through much smaller incisions so that the babies don't need as much pain medicine, they breathe better afterwards, they recover more easily, the babies go home more quickly, the family can get back to their normal routine. Now,
dealing with babies, which I just tip my hat to you, because I know when I did pediatrics, it was just heart-wrenching every time I'd see a sick baby. But what are some of the challenges in taking care of children in contrast to adults?
The biggest issue, the biggest difference is that we treat adults almost as if they're all the same size, whereas children come in all different sizes. You can't possibly treat a 1-month-old with the same medicines or the same instruments or the same doses of things as you would a 17-year-old. So every different child, you have to adjust everything you do to their size. And that's really the biggest difference. Now, the other issue is that children get different diseases than adults do, or they present differently. They may get the same diseases, but they act different when they get them. So an appendicitis in a 2-year-old may look very different than appendicitis in an adult.
Now, children also come with parents. So what are some of the challenges and some of the things that you talk to parents about before their precious child is going to have surgery?
That's one of the most important things that we do, and really realizing that the entire support system for the child and the family is involved in the care of the child. And so you talk to the parents, we want to make sure that everybody understands what we're doing. Other caregivers in the family, sometimes they're extended families that are really important in the care of the child. And we want to make sure everybody has their anxieties addressed and they understand the plan, what we're doing, why we're doing it, and sort of have people on board as to what we expect, what we need their help with in terms of, after surgery. We need to make sure that the little child doesn't jump on the trampoline too soon after surgery or go swimming too quickly with new incisions, things like that. So really very important to get the family involved in the care.
Well, thank you, Dr. Lewis, for being here today. And again, we just really tip our hat to you because I know you got a tough job, and we really appreciate what you do for these precious little children.
Thank you very much.
Now, coming up on Health Matters, the latest trends in general surgery with a local expert. Stay with us on Health Matters.